Okay, so I am here today with Denise Jagroo, who I've known for geez, a lot of years. Um, but this is actually the first time we're seeing each other, sort of face to face. So it's exciting, and I'm gonna ask her some questions about some of the work that she does. She works with physical therapy and biofeedback, and some specialized areas of that. So, welcome. Thank you for agreeing to do this. And so you're a physical therapist?
Yes, thank you for having me. And
You're
again,
welcome.
nice to meet you face to face, even though we've been working together for like 15 years. Yes, I'm a physical therapist. I've been a therapist for 23 years,
Wow.
and I've been specializing in pelvic rehab for, I guess, 16, 17 years. And yeah, so I've started a bunch of clinics. I work at the Manhattan Veterans Hospital. I have a private practice. I've worked in other facilities where I've started like the pelvic clinic there, and I have utilized your company for our equipment to help stock our clinics, and it's an ongoing thing. So thank you for this wonderful relationship and always being there for help, for troubleshooting and stuff like that too.
Well, thank you. We appreciate it. So you mentioned pelvic rehab, and we, we provide biofeedback training and equipment for lots of different applications. Probably the most well-known would be stress management, and then maybe pain management after that, and other things. But the area that you seem to have been focusing on is a little bit more of a niche, area that maybe a lot of people don't even know about. So just the whole idea of pelvic rehab, before we even get into the how you use biofeedback for that, just what is that?
Pelvic rehab in general, it's working with the pelvic floor muscles. So the pelvis is layers and layers and layers of muscle. They contribute to stabilization of the pelvis. They wrap around the pelvic organ, so they contribute to continence, so keeping you dry, and then also contribute to sexual functioning. So they all work as a unit. The problem is we can't see them, right? They're so important, and everything that happens in one area of the pelvis is so intimately intertwined with all the other areas because, all the, like I said, the muscles wrap around the organs. So you can't really separate everything. And so to try to connect with this part of the body, you need special equipment.
And do people do the work like without biofeedback as part of
Yeah.
it?
Yeah. I mean, I like to use biofeedback with as many patients who are open to it, because there's different ways to do it. One of the major ways I use it is it involves inserting something, and not everybody's open to that, which I understand. But there are other ways you could do exercises. A lot of pelvic rehab involves patient education, behavioral modification, just trying to unlearn bad habits that people pick up
Mm-hmm.
along the way.
Mm-hmm.
And so that's a big part of it. But doing the biofeedback for me and for the patients, it's just like I feel it just takes them to the next level. It just gives them that input that they need that they're not getting, because you could do all the exercises and be recruiting the wrong muscles the entire time and
Mm-hmm.
engaging your butt muscles, your thigh muscles, your stomach muscles. You could be holding your breath, and they're not really engaging or recruiting the correct muscles. So having a visual helps.
Yeah, so it's similar to like how we might use it, let's say for pain management. You can tell a person to relax their face muscles because it may be contributing to headaches, and they're like this, and they're like, I am relaxed, and they're not. But then when they actually relax and they can see, let's say, through measuring their EMG activity, their muscle activity, the signal drop on the screen, then they're like, oh, okay,
Yeah.
now I get it. So you're
Yeah.
doing the same thing in a way with the pelvic muscles using the sensors that you mentioned. Most of them are ones that get inserted, and that's we have to sometimes explain because maybe people don't understand. We have
Mm-hmm.
vaginal sensors and rectal sensors that get inserted, and they have sensors. They have the part that actually measures the muscle activity, and so that's how you're picking up what the muscle is actually doing, and then they're seeing it on is it on a tablet, on the computer screen? How do you usually do that?
Hmm. So, I mean, the thing with pelvic rehab, right? Like someone has to go to the bathroom, and if they have issues with leakage, what they do and what most people do, I think, is like if you have to, if you have to go to the bathroom to urinate, like you squeeze your thighs together, or if you have gas and you're afraid of leaking gas or stool, you tighten your butt muscles. But
Mm-hmm.
those aren't the pelvic floor muscles, right? The pelvic floor muscles are on the inside, so you can't see them, right? So I use the biofeedback, which is a connected to the sensors are connected to a unit, biofeedback unit, and then connected to a laptop. So I have the whole software system, the whole clinical system that has software. So the patients, either the female patients, are inserting a vaginal sensor, and like I said, it has those plates that pick up the electrical activity, which display the tone of the muscle, the activity of the muscle on a computer screen, or a rectal sensor for the gentleman. So they have to be open to that. There's also external electrodes that
Mm-hmm.
can be placed in the perineum. Sometimes that gives like more activity of the external muscles, the more superficial muscles, which can give if I will use those if I want to get patients used to the whole experience of it
Mm-hmm.
and the whole idea of it, especially if I'm dealing with patients who have like military sexual trauma history or any kind of trauma history.
Mm-hmm.
Having them insert something right away is not usually something they're comfortable with.
Right.
But if they're open to like electrodes, so I'll say we'll get used to the idea of it. We'll work with the software and the electrodes, and then we move towards using the internal stuff. So then once they have that inserted, they are, we're using different programs in the software for them to see what their muscles are doing, to challenge the muscles. The unit that I have can also deliver a signal, so it can do like electrical stimulation of the muscles if they can't find the muscles at all, and that also
Mm-hmm.
helps.
Mm-hmm.
So there's lots of fun games and silly things that we do, and they get a kick out of it all the time. And they always say this is really weird, and I'm like, I know everything in pelvic rehab is weird because they're playing like vagina video games, but
Right.
it's great, and it gives me like objective numbers that
Uh-huh.
and they can see in terms of numbers like where they are, where they should be, and that helps them too. But visually, they love it, and like the games and everything, they love. Patients really, really respond to this. If the patient is open to it, I do it. I try to do it with every patient because I think it's fantastic, and it's just something that they really like. A lot of people are using electronics anyway and apps and whatever.
Right.
So like this is something that they respond to, like seeing something on a screen,
Yeah.
that's like reflecting what their bodies are doing. And like you said, some people don't realize that they're tensing their muscles. Some people don't realize that they have like, there's one that's like a running graph. And it'll spike, the line will spike, and I'll say like, what did you just think of? And they'll be like, I have to like get to the grocery before I pick up my kid from school, and I can't get to the grocery in time to get like stuff for dinner. And I'm like, do you realize that you clench your pelvic floor muscles when you have a stressful thought? And they'll be like,
It's
I never realized that before. I'm like, now you can see it on the screen that like, when you're
yeah.
stressed, you hold it in your body, you hold it in your pelvis,
Right.
and like,
Right.
and just that awareness is what helps them,
Okay.
and
Yeah.
that helps
And
them.
you mentioned you I didn't this part I didn't expect is that it sounds like some of them are actually having fun with it.
Oh no, it's so much fun. It's so silly because there's one program with like emojis, and like they're
Yeah.
like sad and happy emojis, and you have to like squeeze so that the hand points at the right
Right.
emoji, and then they have to like squeeze enough so that like this hand pops up and starts drawing instruments or whatever, and they just like get a kick out of all that. They think it's so funny. And
And at the same time, it's helping them with something that's a
yeah.
serious problem.
Yes, yes, yes.
So
And
that's
anything where I can like bring some laughter into it is great. And they are like, and that's why it just ends up being so much fun. And I'm so happy when they're open to it because it ends up
yeah.
being very fun.
And what would you say about like the effectiveness that you've seen?
Oh, I've seen improvement with all the patients because they can see the improvement too, like with the numbers, and they'll be like, oh, my line was up here, the bar graph was up here,
Mm-hmm.
and now it's down here. And they always just have like a smile on their face because they're like, oh,
Right.
I got so much better. Even if the graph is like off the screen because
Mm-hmm.
it's so high, their tension is so high, I say that this is still giving us information. Like this is showing
Right.
you like your tension is so high in your pelvis that like it's literally off the charts, right? So,
Right.
then the next time they come in and if they see the line, they're so happy because they can see that improvement. And I
Uh-huh.
think that is like, that's priceless. So I've seen improvement with everybody. I think it's just something that is so integral in my therapy that I do with the patients because
Mhm.
they have like otherwise you can't see. They could be doing all the exercises and be doing it wrong and
Right.
and using all the wrong muscles. And this one, they can see if they're using the right muscles.
Mm-hmm.
Hmm.
Makes a lot of sense. I mean, it's it's great that they're really connecting with it and
Hmm.
they're having fun with it and it's
Yeah.
actually working for them.
Yeah.
You,
There's
you mentioned the continence part, and I think that's the people that do know about biofeedback for pelvic probably think about that first. But you also mentioned sexual dysfunction,
hmm
right?
hmm
And another thing, I don't know if you had mentioned it was is like pain, pelvic pain. And so can you talk about those two a little bit?
hmm So there's different reasons why somebody could be experiencing sexual dysfunction, pain during intercourse or pelvic pain. So if they are in pain or if they're harboring tension in their pelvis for a long period of time, the tone of the muscle is just increased at a resting state, right? So they don't realize it. They'll, like you said with the person's face, like you say, oh, relax. And they're like, I'm relaxed, like that's how they are with the pelvis. They're like, well, I'm not tightening, but they're so used to that on a consistent basis that that's
Yeah.
become their norm,
Yeah.
right? So like holding tension, you can have spasms, you can have trigger points in the muscles, and just this resting, like high tension state. So
Mm-hmm.
having that feedback and like that visual feedback where they can see and they're like, oh, I didn't even know I was doing that. I didn't even know that I was like clenching so much. And then we go through like, breathing exercises and meditation and different stretches and stuff. And they can visually see that line coming down. They
Can you
can.
give me an idea of like starting amplitude and like ending amplitude as far as like when they started and where they get to after working on it?
I mean, like they could be off the screen, like way off the screen. They could be like the scale that there's like from 30 to 0 to 30, right? It'll be like way off, like 50, 100 or something like that, like really, really, really high.
Mm-hmm.
And they don't even realize it. And again, a lot of these are trauma patients too. They've had trauma. So like, understandable, there's a lot of psychological issues as well. Once they're working through that, and we work through like the program because I incorporate it with like like I said, stretching and a lot of breathing exercises and like mind body connecting and awareness and stuff. They can get down to like a 2, and I've seen that like many, 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 many times. And sometimes it can even happen like in a session, in one session, because once they build that awareness, once they are aware of it, then they're like, oh, that's what it feels like to let go. I haven't let go this whole time, and once they're aware of that, then they can do that voluntarily, but they need
So
to see
yeah,
it.
what you just said is like really important because you think about the awareness and just that connection. I see 50 and now I can feel what does it feel like when I'm at 50 and I get down to let's say even 5 and
Mm-hmm.
I feel what does it feel like at 5? Now if I go back to 50, what does that feel like? And just having that contrast. So with the feedback I can tell that. And now when I'm out in my regular world, not having the sensor inserted or whatever, I can still have a sense. Maybe I can't tell exactly the number,
Mm-hmm. Mm-hmm.
but I can have a sense of I'm pretty relaxed right now.
Mm-hmm.
And maybe something happened where I'm upset and now I'm feeling more like I was when I was seeing that 50 on the screen. So now
Mm-hmm.
can I
Mm-hmm.
release and get back down to where I saw that 5 on the screen, and they
Mm-hmm.
start to be able to do that in the real world. So
Mm-hmm. Mm-hmm.
that's
Mm-hmm.
and like you said, sometimes not to say that they totally learn it right away, but
Mm-hmm.
sometimes within that session you
Mm-hmm.
could
Mm-hmm.
see a drop
Mm-hmm.
from 50 to 5, and
Mm-hmm.
it's like,
Mm-hmm.
oh my gosh, I didn't
Mm-hmm.
realize there was
Mm-hmm.
all of that tension, and just think about someone walking around with that much tension that they didn't even know that they had. And
Mm-hmm.
things? Well, you can tell me more than I can tell. What problems that can cause?
hmm I mean, and so just going back a second, they have such great carryover with this because, like you said, like they're aware of the feeling of like letting go. They're aware of that feeling of like holding the tension. So when they're walking, when they're out and their commute or whatever, they're like it helps them be aware of like, oh, this is what it's supposed to feel like,
Mm-hmm.
and so holding tension for long periods of time, like I said, could lead to like trigger points and spasms in the muscles, and it can lead to pain with just sitting, like sitting
Mm-hmm.
on hard surfaces, or problems going to the bathroom, or pain with intercourse. And so it can, just, and because everything is so intimately intertwined in the pelvis, you can just start developing things in multiple systems. It can compress nerves, you can have a neuralgia.
Right.
You can have, scar tissue from like adhesions because everything's so tight and things start to adhere. So,
Right.
and that can cause all kinds of issues. It can affect the posture. It can affect so many different things. So, having visual feedback is always so helpful. And like I said, there's just such great carryover because they
Mm-hmm.
take it into functionally into their like daily lives.
Mm-hmm.
hmm
So, and how did you start with this? How did you get started with it?
With biofeedback,
Yeah.
I think we like my first course in like it's specifically in pelvic, they talked about it and they used like a particular system, and I thought like, oh, this is really, it was a very basic system. And a lot of the early systems were just lights and
Uh-huh.
just like sounds or something like
Uh-huh.
that, and not like the whole software system, and had a very
Right.
basic like black
Right.
and white little unit. and
Uh-huh.
um and so I thought like, oh, this is really good. And I pitched it to my chief here many years ago, and I was like, I think
Uh-huh.
this would really help, and so we had a budget for it. And they had, because I work at the VA, so they had this new initiative to for female veterans to just to have more catered and tailored care to them.
Uh-huh.
So there was like a budget,
Uh-huh.
and so I was able to like get whatever equipment I needed and start the clinic. And so, and I just saw how effective it was that like the other endeavors that I had, I made sure that I ordered
Right. Right.
a software unit and a biofeedback unit so I could use
Right.
it with the patients.
Do you find, is it widely used in the VA?
I'm not sure. I mean, I know other clinics have it. I don't know that. I don't know how much other people use it, but I feel like it's something we all learn about. I think if there's any like pushback of having, it's for budget reasons because every facility is different. So,
Right.
like I'm the only pelvic physical therapist like in the New York, like the New York City VAs and stuff like that. So I was able to like get the budget I needed for
Yeah.
me. But it's a
I
more of a
remember there was one in it's either Houston or Dallas where they were doing a lot for a lot of years, and
mhm,
then the person retired and
mhm, mhm,
anything more. So I don't know what happened
mhm.
with that one, but it's and even outside of the VA, do you feel like it's widely used by physical therapists or not yet?
I mean, I think it's something that we learn about in school and like our, specialty programs and stuff. And I think like everybody wants it. It's just, budget constraints, I think. But I think like it's definitely something that is very present, and, I think everybody would want it in their clinic. But
Mhm.
another big thing is like real-time ultrasound people want, and like we don't have the budget for that.
Right.
But like that's another way to like diagnose and treat whatever. But to me, I feel like the biofeedback is really, really fantastic, and I love it.
And in private practice, you've also had
hmm
pretty good
And I
success.
know I know other pelvic PTs have units, biofeedback units as well. hmm
Okay.
hmm
Anything else you'd want to share about it that I didn't ask you about?
Yeah. This is such a random thing, but like another thing I use with the sensor, and this is kind of funny, I guess. So if the patient is, if they have incontinence, they have weak pelvic floor muscles, they can't find the muscles, I play tug of war with them with the biofeedback sensor. I know that sounds weird, but I want them to win. I know. And then so I take the cable that's connected to the sensor and I try pulling it out and I have them fight me. I'm like, okay, make sure like you try to keep it in. And
Uh-huh.
then some of them can do it and then some of them it just like flies out and they can't find the muscles and some of them it's like it shoots across the room. But I mean it helps me see if they have resistance,
Right.
and it helps them if they can feel it like sliding out, then that's also like feedback because I'm like,
Right.
oh, that's different sensors and stuff. So they can it helps to engage. It's a different cue to help the
No, that
muscles
makes
engage.
sense.
So it's another way to use
Yeah.
unconventional way to use the biofeedback sensor,
Yeah.
but it works.
Yeah, it makes a lot of sense. And so
Mhm.
do you do other work with biofeedback, or it's all focused on pelvic rehab?
Well, I always, we have a guy who does post-op for patients here. I show him, he's used it with some of the patients to do sort of like post-op knees and like ACL repairs and stuff like that,
Uh-huh.
and knee replacement to help, be aware of the engaging the muscle.
Oh,
He doesn't use it as much, but that's another way that we can use it.
interesting.
Hmm.
Okay.
Oh, and I've had like a stroke patient that I've used because it has like stim to stim
Uh-huh.
their muscle. So that's what I've used it for as well. And have
Great.
her see if she's engaging the muscle or not.
Great. Okay. And would you say what would you say the mix is of the patients that you work with in terms of gender?
Well, I mean, we're heavily like male dominated, but like since I do pelvic, like I would say like of my pelvic caseload, because I've
Yeah,
been
that's
doing
what
so much with like I've been working a lot more with GYN lately, so I'm 50%. 50 I
okay.
see 50% male female.
Okay. Because yeah, I think probably, in general, I think people would assume that most of the people that are going for pelvic rehab would be females.
Oh no, I have a
But,
lot of men. Yeah.
but I'm just saying what people would
Yeah.
have the perception of that.
Yeah. No, post prostatectomy incontinence, constipation, testicular pain. Like I use the biofeedback. Yeah.
Yeah, yeah.
Yeah.
Because we actually had one of the hospitals that did a lot of prostate surgeries. They would send people to get biofeedback devices to practice with afterwards to
Yeah. Mm-hmm.
help
Mm-hmm.
the
Yeah. I mean, I'll say the men aren't as open to using the biofeedback as the women.
yeah.
But when they do it, it's effective.
Yeah, yeah.
Hmm.
Well, sometimes it's like even though something could help you, you have some mental blocks, I think, and I think a lot of the guys do have that, but
Hmm.
they might be convinced if they really want to, deal with the problem that
Hmm.
it's a short-term thing that they just have to deal with, and
Yeah.
the results will be worth it. So.
Hmm. Hmm.
So yeah, I
Yeah.
mean, I really enjoyed asking you some of these questions and learning a little bit more about what you do there, and
Hmm.
I look forward to another 15 years or whatever
Yeah.
working with you.
Yes. Thank you so much. Thank you
You're
for
welcome,
having me. Thank you for
of
your time.
course, and
Hmm.
look forward to talking to you again soon. Thanks for
Okay.
your time.
Yeah. Thank you. Thank you for having me.
All right.
Okay.